For a father to see his kid in pain, it hurts.
At first, I didn't know how to do anything for myself, so I'm like, how am I going to do anything for my baby?
They just want to be kids, but they have all these issues that they have to deal with.
Finding the best way to reach those kids and finding how we can improve their lives.
That's our goal, is to try to keep kids basically out of the hospital and out of the emergency room.
CHECK is a program that focuses on the non-medical barriers to healthcare.
Making people feel empowered to take charge of their own healthcare by maybe finding transportation to the pharmacy when they don't have it. Maybe helping with a three-way call, navigating the ridiculous amount of prompts through making an appointment and helping make an appointment.
We're here to help families, to link them to resources, to better engage in care, and also increase school enrollment.
CHECK focuses on 4 main conditions: diabetes, prematurity, sickle cell disease, and asthma.
The reason we chose these conditions is because they have a really deep impact on the children and families, because they're difficult to manage. They can result in losing school days. That means your child may have a lower likelihood of graduating high school in the future, and they also, of course, are very costly to the health system.
A lot of them are dealing with social service issues, housing.
A lot of families, they don't have a daycare or child care for their families.
A lot of them do not understand their insurance providers.
So we go after all those issues: housing, food security, mental health problems, difficulties with medications, difficulties reaching doctor's appointments. The idea is to kind of create a medical neighborhood around the child such that the family has everything they need as close as it can be right at hand to the family.
Have you talked to the surgeon about getting a surrogate fix?
As a care coordinator or community health worker, we're here to link families to care.
We sit with the patient and we come up with a game plan together, and to get the best possible answer and outcome.
There you are.
And then they're coming back to the main hub and they're having interactions with other care team members, and they're figuring out what needs to be done for that family. Well, we really have a wonderful multidisciplinary team that includes physicians, nurses, social workers, community health workers, mental health professionals, database experts, data analysts, and they work seamlessly together to understand the unique situation of every particular child.
So we're going to be meeting actually with YMCA, and we're going to...
And so this keeps the communication flowing better. So it's a way to use each one's skills more efficiently.
We just educate them about their disease and how can they overcome all these obstacles.
Here's her ribs, right?
They constantly educating me on how to deal with crises if they occur.
We help patients develop an understanding of their diseases and how it impacts them, but really help them take care of themselves, and so they're not sick so much.
Do me a favor, take a deep breath.
Eventually, what the goal is to have the parents or the patient be able to manage their own care.
We want to help them, internalize and be able to, do things on their own. We're not here to be like, we're going to be constantly calling you and telling you what to do for the rest of your life.
Thank you, sir. We're finished.
I've seen them go from not being able to handle their own doctor's appointments to calling me on the phone saying, hey, Mr. Gayton, I set my own transportation up. I'm on my way to the doctor now.
I'm just going to count your teeth really quick. Can you open big like a lion?
We're making real changes. We are putting great people into the community in multiple different ways to make change happen.
We're really powering families into the future, and many of our families just need a few resources, some organizational assistance, some mental health assistance, some oral disease assistance to really improve their own health and well-being and improve their child's prospect of the future.
Chronic illness shouldn't be a barrier to life. It's hard and it makes things a little different, but they're capable of anything, and that's what we want them to see.
I think if we could continue the program and expand it, I think we could really, really impact care.